Good afternoon, everyone. My name is Yavuz Gencer, and I'm the Deputy General Manager at AKGÜN Technology. And it's a privilege for me to be here today with you. So today I'll talk about not the concepts, but what we do actually in HIS and for the healthcare industry. So I'll talk about a little bit of the company and the projects that we are actually having. So AKGÜN Technology was established in 1986, and it's a research and development company. We've been working on a lot of different projects. We've been developing HIS system, hospital management information systems actually, end-to-end turnkey software solutions for healthcare institutions, including the EMR, laboratory radiology information systems, PACS, some specific solutions like intensive care unit management systems, and some AI solutions for the cancer detection and so forth. So there are more than 800 people working for the company, and most of them are engineers developing software. And our headquarters is in Ankara, in Turkey. This is our research and development center, and we have other branches nationally and internationally. These are our branches in Turkey. We work with more than 350 hospitals, which is almost 35% of all the public hospitals in Turkey, and that makes us actually the market leader in Turkey. And we have branches other side of Turkey as well, and we have over 200 clients outside of Turkey. And as I said, we work with 350 hospitals, and some of these hospitals are PPP hospitals. Mazen just mentioned before. So public-private partnership hospitals, and these are some of the hospitals that are having HIMSS Stage 7 certifications, 6 and 7 certifications. HIMSS, I know many of you may probably know about HIMSS. It's an international organization that classifies the hospitals by their digitization levels. So the Stage 7 being the highest. So that means that everything in that hospital, all the processes are digital. There is no paper, nothing is used in those hospitals. So this is what they are, and we have many national and international quality certifications, security and integration certifications, and we work in many different areas, including healthcare, education, telecommunication, defense, and so forth. But the healthcare is our main field of activity area, so 90% of what we do is in actually healthcare. We are experts in a lot of different areas, like business process management, decision support systems, web technologies, mobile, and so forth. And we produce, as I said, end-to-end solutions for hospitals, and they are scalable and in parametric structure, actually. So our HIS has many different modules, but it can fit to any of the small or large hospital, different kind of hospitals actually, depending on the needs of the hospitals. And we actually produce end-to-end solutions. That means we're having the EMRs, PACS, laboratories, and ERP as well on the administrative side as well. So this is actually showing that we cover all the areas, all the departments in the hospitals. We call them turnkey solutions for hospitals, and they all can be customized for the needs of the hospitals. We have been talking about all this HISs, laboratories, and all that, but today I'm going to talk about a little bit of the centralized solutions that we have. In the Turkish case, we work with 23 cities in Turkey. So that means that they're called the provincial healthcare authorities. So let's say in one city there are like 20 hospitals, and they are all connected to the same data center, and they are all managed from the same data center. So that means that it's like a private area for those hospitals where they can share information between each other. So all the patient information can be, as long as the patient actually consents, can be reached by the other hospital, other client, other physician. So let's say as a patient, if you go to one hospital in that region and get some maybe images taken or laboratory tests done or any kind of treatment that you get, And if you go to a different hospital in that same region, they can actually see all your results, all your medical history in their screens as well. And that allows the managers, the healthcare authority managers, to actually track all the data, all the information from the hospitals. They can see what's happening in those hospitals. What are the number of patients in each department, and what are the outcomes of those treatments, and how much money they are spending and how much money they are earning. They can track actually all the things in the hospitals. Okay, we said that. And as we said, it's like parametric, so it can be used in a specific hospitals, like in the hemodialysis, oral dental centers, and etc. It can be customized for that. And we also have this patient portal application, so where the patient can see all their results or medical records, all the laboratory results, all the prescriptions and everything. They can be seen on this patient portal application, and also they can make appointments, and they can share the information with the other doctors as well. So this is another one, central laboratory information system. So similarly, actually the business process for this is like, as you may all know, what we do here is like from the beginning and to the end, we've tracked all the processes in the laboratories from when the test request comes and the materials collected, and everything is barcoded, and all that time between the material collection and the results come out, all the processes are tracked. So this is showing that process. When it's used centrally, all the information can be shared between the institutions within the same cluster. That increases, of course, the quality, and if the one test is done, and if the patient goes to another hospital, if they don't need to do the treatment again or the test again, then they can reach that information straight away. We talk about the technology. It's a web-based, of course, browser independent, and has mobile applications and can be downloaded from the app stores, and has multi-language support too, so it can be used in many different languages. And we have actually all the national and international quality integration standards. So at the moment, there are maybe more than 600 different devices in laboratories that we have integrated with. And if any new device comes up, with these standards, it can be easily integrated with the system. The other product that I want to mention is the smart teleradiology product. So it's again a centralized solution for the radiology departments. Even if they are using different PAC systems, we can centralize those systems together. So as we said, it's filmless. It's a centrally reporting. So because there is I run out of time. There is a lack of number of radiologists are not actually easily accessible. So the institutions can share data between each other, and then they can do the radiologists can do the reporting for the other institutions as well. It increases the quality and everything. So I'm just going to go a bit quick because I want to show a video because time is short. I can actually show everything from the video. That will be easier for everyone to actually see and understand. We collect all the data from all the modalities in the radiology departments, basically, and these are it's the summary of it. And we also use in the smart teleradiology project, we use some AI solutions like X-ray, mammo, and thorax. They detect the cancer cells from the X-ray lung images and X-ray mammography images for the breast cancer. And there are a lot of difficulties. There are large image volumes because the radiologists have to go through a lot of images daily, and some of the nodules can be too small to be seen by the radiologists because they are too small, or they might be hidden behind another tissue and all that. And the human eye, because These are from the X-ray lung images, so it is not tomography or anything. It's from the X-ray lung images. So it might be not easy for a human eye to see actually these cancer cases in those images. These systems are able to process like 60,000 different shades of the color and easily can detect the cancer cells on those X-ray lung images. And this is how it looks. We call them presentation state, the one on the right to you. So in the presentation state, doctors actually don't need to do anything here. As soon as the image is taken, it goes to the AI system, and the system actually processes this image and marks all the suspicious areas and gives a structured report, the one on the left, and tells the location of the cancer suspicious area, and it tells the benignity and malignity of it, and it gives all that structured report on with all the information about the cancer. And this is the mammo actually similarly has the same structure, and it detects the anomalies like the microcalcifications and masses, and tells the difference between those different anomalies, and it tells the benignity and malignity, of course, of that too. iVital is one of our product for the specifically designed for the intensive care units. So this is for intensive care unit management system actually. As some of you know, in intensive care units there are these large nursing forms, observation forms, and everything, all the data about the about the patient needs to be recorded on that paperwork, and it needs to be done like in every hour or in every few hours. So this system is actually digitize all of those processes and connects with the HIS laboratory radiology information system and gets all the information from those systems as well, and requests can be done also from the system. And we integrate all the devices in the intensive care units, like the ventilators, bedside monitors, infusion pumps and everything, and collect all the data from all of them, and then all the calculations, scoring calculations like Apache, sepsis, SAB, all that different calculations, there are about 30 of them, can be done automatically by the system. It generates early warnings and alarms about those findings. And it has a mobile application, so the doctors actually can create a patient follow-up charts for each patient, and they can assign it to a nurse, and the nurse follows up all that processes throughout the day, and then they can all these follow-ups goes into the system obviously, and it gets sent to the doctor, so the doctor can follow up their patients, or they can interact with the patients actually wherever they are, even if they are outside of the hospital as well. So this is the presentation. Thank you very much. And there is one video that I'd like to show. This is one of our hospitals in Turkey. It's the first HIMSS Stage 7 hospital in Turkey. It got certification in 2017. That was the first Stage 7 hospital in Thank you very much.